All right, here we are again. This is Dr. Garner and our lovely patient model. If you want to, you can pull that pillow up under your head.
Yeah, I was just thinking that might be a little more
comfortable.
Good thinking. Okay.
And a little bit better because you want to be in spinal neutral.
Mm-hmm.
We don't want a lot of twisting and rotating through the spine. That's why we have this giant bolster. I mean, you could do it with a really uncomfortable sofa cushion or something because it doesn't collapse. She's going to be in hip flexion. We're calling this one Sidelying Decompression, and the reason I'm calling it that is because in absence of, and I'm going to talk in front of the mirror for a second, in absence of your therapist being there to do a manual therapy for the sacroiliac joint to address a left on right posterior sacral torsion, that's just a fancy way of saying if this is my sacrum, okay, my low back, it's sitting like this. Now, I've said this in a previous video, okay? So when she goes up into a cobra yoga pose, it does like this. That's not a problem, okay? Torsion is not a pathophysiology, so don't put me on the wagon of clinicians obsessing over someone being out of alignment, okay? That doesn't exist. However, if it's causing problems, sometimes it can cause neural issues, fascial issues, pelvic pain, definitely can cause hip pain. And for this particular individual, she's having pain when she comes up into hip flexion and internal rotation. You'd want to test that laying down, not standing up like I'm doing it. So what we're going to do is bring that sacrum from this position, which is also causing her back pain and pinching in the hip and the SI, and we're going to bring her back into this position using her own muscular effort instead of me fixing some kind of alignment, and then as soon as she gets back to her car, it's already back in the same position that it was in before, right? We could needle, we could do manual therapy and massage, we could do mobilization and manipulation. But the best case scenario would be if I can teach her how to do this at home. Yay, all right. So what she's gonna do is only come into enough hip flexion where she can feel, so I'm gonna have her, sorry about my camera angle, you guys. She's going to feel that side of the sacrum, this side of the sacrum that wants to go like this, okay, is coming forward a little bit. So bear with me again on my camera angle, you guys. If I'm over here on my spine, it would mean this side's deep and this side's shallow. So it looks like that, okay? So she's monitoring that on the right side of her sacrum so that as she brings the knee into the chest, it kind of feels decompressing. Mm-hmm. The next position, she's going to bring that left leg and just slide it back as delicately as she can, trying not to lift it. And I'm going to bring her up into neutral. See how she was way over here before? Mm-hmm. Go ahead and come up into neutral. Okay. So the hips stay stacked. So she's going to bring that left leg back, just nice and easy, good, to help her encourage the sacrum to go back like this. Now, she's going to straighten that knee out only as much as she's able. She's going to externally rotate and turn that toe to the sky. Stay in neutral. Use your abdominal muscles to support it, and then lift and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, staying in neutral. Bring it down. Good. Then she'll try and maybe bring the knee up just a touch more while she slides the bottom leg, maybe a touch more back. Her sacrum should still feel fine. Good. And then she'll do that 2 more times. So let's do it again. Straighten, rotate up, toe to the sky, and lift. 2, hold for 10, 6, 7, 8, 9, 10, and release. Good. And she might do one more little adjustment, bringing the knee up, left leg back, stay in spinal neutral with the hips stacked. Straighten the knee as much as you're able, rotate the toe up to the sky, and lift again one last time. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. And release. All right, so again, why are we working on that? We're working on that in order to be able to bring that sacrum here, back to here, not because it's out of alignment, but because it's creating a lot of other soft tissue issues and SI joint and back pain and hip impingement. So for all you guys out there with hip labral issues or SI joint issues, It actually may be coming from the muscle firing around it. It's not necessarily the alignment itself. All right, I hope this helps. If you like this video, don't forget to subscribe.